Good day, everybody, and welcome to Dental Voice with Zyris. This is season 2, and my name is Rolando Mia. When you look at Dental Voice, the purpose of Dental Voice is to hear from clinicians, is to hear from people and understand the experiences that they're having, the perspective that they have, and get some advice. Well, this season, our focus and the context of our discussion is around separating reality from fiction, because there's so much information out there. In addition to clinicians, another aspect of what we do is working with patients. So today we have a patient, and we have a very special patient. Our guest today is one of my colleagues. Her name is Darina Lapkova. She is the multimedia designer at our company. And what I discovered is that she's just recently had or has been going through the dentist. So I asked her to join and share her experience, and she's excited. Hey, Darina, how are you doing?
Hi, Rose. Super excited to be on your show. I've heard a lot.
Awesome. So if you would, please, could you kind of take us through what first of all, before we talk about your experience, what is your perception of the dentist? And, before any of this COVID stuff, if I were to say, hey, let's go to the dentist, what would your kind of response be?
I mean, I think my perception of the dentist is fairly similar to anyone else's. I don't know anyone that's in love with the dentist and that's super excited anytime they have a cleaning or they need to go in for whatever. So I've never really been fond of it. I've always dreaded it. Let's just say I am a problematic patient. Every time I've been to the dentist, there's always something. I've had so much work done in my mouth. No veneers though. Just like root canals. There's always a cavity, and I think that's just my genetics. It's not like I don't take care of myself. It's just I always have something wrong. So I think the dentist has a lot of fun with me, but I can't say that about me with them.
So has your experience been, every time you've gone, has it been kind of scary? What's the feeling that you get before you go?
I would not necessarily say scary. I mean, I'm not that young anymore, but there's always this sort of tension that I feel I think it's been embedded in me since I was a young girl coming from Bulgaria. They do dentistry, or back then they did dentistry a little bit different than they do here. You don't get the numbing jelly, you don't get the pain shots, so you kind of just go along with the pain. You take it in. So even though they do things a little bit different in America, I always hold that in the back of my mind. So yeah, it's just I'm not really scared, just tense to what's going to happen? What are they going to do? How is it going to feel? So, yeah.
So now add on top of that, the fact that COVID hits us and there's all sorts of stuff that's going on. How is that kind of impacted, or has that impacted your feeling about going to the dentist?
I think, since I do work for Zyris, I'm a little bit more familiar with aerosols and how it could potentially affect your visit going to the dentist. So I would say I might be a little bit more cautious than other people, or I might be looking for different things know different things than an average person would when they go into the dentist. But I am secure, or I feel safe when I do go, because these dentists, just the dental industry, they've been dealing with aerosol control or infection control forever. I don't think I'm gonna get sick when I go there. So I'm still gonna try to avoid it. I'm not running to the dentist or anything, but I might not go in for my next cleaning or something like that if it's not completely necessary.
But you had to go anyway, is that right?
Yeah, I did.
So what was that experience like? Take me through that. I'm really curious to, you're already a little apprehensive because of past experience with regard to dentistry. Now you have to go in, and what was that? What happened?
I mean, I think I was mostly curious just to see how they are handling this. Like, what are the different protocols that they have in place? So, you get the usual, like, you sign in, you have your hand sanitizer, you have to wear a mask. What was the question?
The question is, what was it like? Yeah, exactly. So you had to,
Oh, okay, yeah.
sanitize the West. What was the experience like as you were going into the dental
I
office?
mean, it was pretty positive. It's just as I expected. You have to wear your mask as soon as you enter. You can't take it off. You try to sit like as far apart from other people if there are any people waiting. Um, One thing that I thought it was a little bit weird, but it does make sense. I mean, it doesn't make sense, but you're supposed to wear your mask till the dentist starts working on you. And as you know, the dentist comes, you chat with him, and then like he exits, and then the assistant prepares you, puts the bib or takes pictures or whatever, and then he comes in again. So I was supposed to keep my mouth mask on the whole time and just take it off for like the pictures and immediately put it back on. And it's the second time the dentist came in, I had to take it off, which didn't really make much sense to me. He was like covered in gear the whole time. And then like I was going to open my mouth regardless as soon as he started working. So the mask in that sense didn't make sense. But it was definitely everything I expected.
So there wasn't, and it's interesting. So when we talk to our clinicians, one of the biggest questions or one of the biggest things that people are concerned about is the potential for becoming infected. As a patient going into the dental practice, did you feel the apprehension around that, or did you feel that like, uh-oh, I'm potentially putting myself at risk and all that?
Not necessarily. Just seeing the dentist being in full gear was kind of like, whoa, okay, they're taking this seriously. Should I? But I never thought that, okay, I'm in danger here. I might like get sick from this. And again, these people have been doing this forever, and I don't think they would even have me in the dental office if they thought that I could potentially get sick. And again, they do the background check. You answer a bunch of questions. So if I was to be, so I wouldn't go to the dentist if I was sick, if I even felt like a light fever or a cough or something. So in my mind, I don't think other patients would go to the dentist if they felt the same way. And if they did, they would like write it down on the piece of paper. And I don't think the office manager will even like let them go into the operatory. So I never felt like I was like in danger or like it didn't feel safe. It was just like a little bit off-putting to see the dentist like looking like an astronaut. Usually they wear all that when they're like gonna take out your tooth or something. It's like a surgery because there's like splashes and everything. But yeah, it was just a little bit weird to see.
But not too bad. So it's interesting. You didn't feel, that you were potentially risking your welfare or your well-being when you went into the dental office because everyone was wearing all sorts of stuff. Is that kind of the deal?
Yeah. No, I felt good about it. Like they look like they know what they're doing.
So
If you're allowed to go to a restaurant and eat, I think we're okay to go to the dentist, and that's like you kind of have to do that while you don't have to really go out to a restaurant.
yeah, that's cool. So let me ask you this. Because you work with us and you get to see a lot of things that other people are doing, you get to see what other stuff is. Do you feel that somehow impacted kind of the feeling that you had before going to the dentist, or is that just how you perceive it from the get-go?
I mean, I definitely gotten a lot of more education when it comes to dentistry and and just protocols and aerosols, and especially with COVID. So I do think like working for Zyris has made me view going into the dentist in a more. It feels like it's more. I'm more at ease going, right?
Yeah.
Well, if I was just like if I didn't work for Zyris, I think I would definitely be kind of more cautious as to going to a doctor or a dentist. Um, but
So let me ask you this. If your friends came to you and they're like, oh, Darina, I don't know if I really want to go to a dentist because, I mean, what would you tell them, or what kind of advice could you give them based on you going and then based on kind of the experience that you had there?
I think you shouldn't push anything if you don't feel comfortable. And especially when it comes to a dentist right now, don't go if you don't need to go. So if you're just trying to like, I don't know, see this chip tooth right here and like try to get it fixed, maybe that's not a priority. But I think if they do go, there's nothing to be scared about. Um, again, these people are doing everything they can to keep you safe, and just is it a priority? And if it's not, then don't go. If it is, just you'll be okay. There's nothing to be scared of, in my opinion. And in my opinion, and but like I know what could potentially go wrong, but I also know what these people are doing so that you don't get sick. So I think I would be the best person if my friends were to ask anyone, should I go to the dentist? Yeah, come to me. I'll tell you. Like, I actually like make the ads for these. Like, there's a lot of like articles that we read. Like, I know a lot. So yeah, come to me and you'll be fine. But yeah, there's nothing to be scared about. I don't think so. I mean, of course, there's always something to be scared about, like pain.
Right.
You could potentially get sick, but is it a priority to go to the dentist? That should be your number one thing that you think about when you go in.
So if you were sitting here, our audience are clinicians. These are dentists, doctors. These are hygienists, dental assistants. What feedback would you give them with regard to how to engage with a patient, what to say to patients, or what to do?
I think just letting the patient know that this, like what they're doing and what they're wearing is just protocol. Just assuring the patient that they'll be fine. I think that's enough. I don't necessarily need to know like what could potentially go wrong or like, all the dangerous stuff. I don't think you need to scare anyone into like, but just explain why you look the way you do, because no one's used to seeing the dentist in full gear or with the face shield and the assistant. So that's just a little bit different. So all these clinicians just need to communicate better with their patients. And I think that would just like go so far when it comes to a person visiting the dentist.
And when you say communicate more, it's not say all the crazy stuff. It's
Right.
What do you mean communicate more? Just more engaging? Do you feel that it's harder for them to engage or talk with you because they got all this stuff on them and everything?
I mean, no, just like acknowledge the differences that are happening in the office right now. Like, hey, I know you see my face shield and I haven't taken it off once. We're doing this because this is protocol. We live in a crazy world right now and we're just trying to protect you and ourselves. So from now on, this is what we're going to be wearing. Don't be scared. It's all going to be fine. Like something like that, I think would make me feel more comfortable and anyone else as well.
Is there anything that you would have them change with regard to you said they screened you. I think you said they took your temperature, put the mask on, all that type of stuff. Is there anything that you would say, hey, you know what, this seems a little over the top, or, you don't need to do this, or anything like that?
I think like once I'm in the operatory, I don't technically think I should have a mask on. It's just, I think it's counterintuitive. I think it's an overkill. Like, how many times do I need to put on the mask and take it off while I'm like sitting on the chair? Like, maybe that could change. But as long as you're like in the lobby or getting like those pictures taken or whatever that's called, I totally agree that you should have your mask on so you don't potentially like breathe onto someone. But once you're in the operatory, I feel like it's okay to take it off. I mean, felt okay for me to take it off.
So it's interesting when you look at what we've been talking about a lot on Dental Voice, we've been talking a lot about aerosols. We've been talking a ton about infection control. We've been talking about how to minimize the potential for all of this to get out. What kind of background, or what, from your perspective, how much did you know, or do you know, about aerosols, infection control, and where does that kind of sit with regard to the perspective that you have when you're going into the dental office?
Dang, Ro. Okay.
Well, your thoughts on aerosols. I mean,
from what I know, from
dang,
what
Ro.
I've seen with Zyris, is as soon as one of those hand speed tools touches your
Yeah,
tooth,
high vacuum.
yeah, the vacuum. The aerosols are out in the air, right? They're living out there. And this is why, they disinfect the office before and after any other patient come in there, because like if it's in the air, it needs to land somewhere. So that might be like on me, it might be on the dentist. So that's why they wear the gear too. So they need to have the right equipment to prevent from, or to minimize the aerosols that are out there. They need to have the ventilation system that's like constantly working. Is just disinfecting and just being cautious of it, and not exposing everyone in the dental office to it. So
Now, did you
yeah,
know that before working here, or is that what you've learned since working here?
that's what I've learned since I've worked here. But when
So
you
think
really
back.
think about it, it kind of makes sense. Like, let's be honest, we've all looked down while the dentist is working on us. There's like these little water particles or whatever that are in the air. We don't really think about them. You just see them. But now in COVID, if you actually think about it, it makes sense. Like, this is what these dentists are trying to like protect themselves from, and potentially the next person after you. But I never even thought about that before Zyris.
So prior to here, or prior to working with Zyris, this whole idea of aerosols, this whole idea of spray and splatter wasn't even it was just kind of something that happened in the dental office. And you're like, yeah, whatever.
Yeah.
And then now you're looking at it, and what are you thinking?
Now I'm thinking like, me walking on the street, it's like the same thing. Like, people that are not wearing masks and they walk by you, like, now I can feel their like breath on me. Oh my god, that just like brushed my face. This runner was like, I'm like, that's aerosols. I feel like that's like, that's their little germs from their mouth, the same thing that's coming out when they're in the dentist's office. But in a dental office, it's such a small space that they really need to get rid of them, or not allow them to spread. While when you're out and about, you really can't do anything. They're just like kind of like fly away, and hopefully they don't brush on you like they do on me. But yeah, definitely think about it more than I would like to, than I did before.
And it sounds like, because you were in the dental office, because you saw everything that was going on, it wasn't as big a deal, which is pretty cool, because we're kind of hearing something similar where, as clinicians, everyone's really focused on this, and they're all trying to do stuff to do that. And then you're kind of validating that patients are not as concerned about it because they see. Is that kind of what I'm hearing from you?
Yeah, I mean, they're the pros, right? They
Right.
should know what they're doing. And
Sure,
I think if you're not too sure about your dentist knowing how to handle this, then you probably shouldn't be going to them. Like, right? Anywhere you go to, any specialist, you should feel like at least 99% comfortable that they got this.
Or don't go.
Yeah, or don't go. If you don't feel comfortable, like, my dentist is kind of an idiot. I probably shouldn't go to him at this time. Then don't. Like,
Right. If they're not following these protocols, all that, then you're like, okay. And that's true. You have a choice. You get to pick whom you go to, which is, I think, an important thing, because you're not tied to one provider if you want to find somebody else. than you
Yeah,
do.
I mean, when I moved to LA, I probably went through like 6 dentists, and I lived in Venice, and I found one in Laguna Beach. You bet your sweet ass that I made the trip to Laguna Beach because I felt really confident in his abilities and his knowledge. And so, yeah, you definitely have the choice. You're never stuck with a provider or dentist or doctor
So,
or
so
anything.
I'm curious, when you chose or when you decided to move from one dentist to another, what were some of the things that you were looking for in the clinician that made you feel comfortable with one versus another?
Um, I think something that really stood out to me with all the dentists that I have like stuck to for a while is they were very, very knowledgeable, and they communicated like beyond what I needed to know about my crown. And they were conscious that, dentistry is kind of expensive.
Right.
So even though you have this problem, this and that, this is not really a priority for us right now. You will be fine if you don't take care of this for a while. Let's just handle this, and let's handle it in a way that's gonna be beneficial to you in a few years, where it's like not gonna like get destroyed, and we're gonna have to redo this. So just like that knowledge, like being very respectful of my money, my time, my health. Um, really, really made me confident in them, and that's why I stuck around with them.
That's pretty cool. So you're seeing a lot of things that dentists are doing and or not doing in with regard to exactly that, being open, ensuring that their patients or the community around them understands. What are some of the things that you think are awesome? And then what are some of the things that you're seeing that you're like, dudes, don't do this at all?
Like currently or in the
Yeah, currently, yeah.
well, bro, I've only been to one dentist recently.
Or not just that dentist, but other ones. Are you seeing anything that you feel, this is really, as you look around, this is cool. Dentists should do this. Or they shouldn't do this. This
You know
is
what? There's one thing that sticks out to me that's like pretty annoying. Why do I have to take a x-ray or whatever they do of the tooth every single time I'm in the dental office? Like, shouldn't that information be passed around to other dentists? Like, isn't there like a database where you can see all my pictures from last week? You have no idea how many pictures of my mouth have been taken. That's just like a little annoying. I feel like they should figure that out.
See, that's right. See, there you go. So
That's the only thing that I can think of. This like really grinds my gears. I'm like, is you charging me for this? Like, I paid for this like last week. Just because I went to a different dentist doesn't mean like my tooth changed,
no, I totally hear you. And that's well, that's totally you. And as a patient, because we are constantly talking about it, sometimes we tend to forget, and we need to put ourselves in the space of a patient and to understand what that experience is. I like what you said earlier on, where don't scare me with, what was it you were saying, all the crazy things that could happen,
Right.
or
Yeah.
when you say all the crazy things, what are you talking about?
I guess I think aerosol education could be important, and it is, but I don't think you need to tell a patient like, hey, there's a lot of like little germs coming out of your mouth, right? So you could have COVID and it can land on me and I can get sick. And guess what? The patient before you, his germs are out here too. So they could potentially go in your mouth. Like, I don't need to know that, like, like just having that information, like, oh my God, like, I shouldn't even be here. Like, my mouth should not be open because like Joe's germs that went in before me are gonna be in my mouth as soon as I open my mouth. Like, that's scary. Like, I know that might not be the thing that's gonna happen. I know that might not happen, but just the thought of it,
Yeah.
It just makes me uneasy. Like, it's like, what if? Like, I'm already an overthinker. Like, if you tell me that, I'm gonna blow it way out of proportion.
Dude, it's making me uneasy. I'm
Right?
like, So are there from a just from a patient perspective, from a patient view perspective, are there any things that you know, in addition to that, that absolutely clinicians need to do beyond communicating? Anything else?
Clean your operatory. Let me see that there's like a lot of like cleaning products, disinfecting, like what is it called? Sanitizers everywhere. And I would love like I need to see the assistants and the doctors are always like washing their hands and sanitizing, and like nothing is like out and about just like hanging out. Everything's like, covered up in plastic, brand new. I don't even know, are all the tools like brand new, like the little metal things? I have no idea.
Yeah.
But just like seeing a clean office, for me, scent is very important too. Like when I go anywhere, if I'm not hit with a fresh smell or just like a cleaning smell, then I get a little worried. I'm like, okay, there's like a little bit of a old kind of smell in the air that doesn't, like, to me, that just like already off the bat dirty, like unsanitized. So just keep your operatories clean, look clean, look like clean yourself. Let me see it.
No, I love, you know what? I never even thought about it, but the point that you make, which is you walk in and you smell, and if it smells fresh or clean or like it's been sanitized, immediately like, okay, cool. But if you walk in, regardless of how nice a practice looks, if there's a funk,
Yeah.
I totally get that. I totally get that. You start going, okay, wait a minute, what's going on in here? I never even thought about that. So that's crazy. That's pretty cool.
I have picked out Airbnbs for my stays. Like this house looks like it smells. Like it just looks like it smells. Not that it's dirty. I can't see anything. It just looks like, and I have never been wrong. Like, because sometimes I'm not the person that picks them. I just make the comment like, this is gonna smell. We go in, it smells. It's a superpower. I don't know what it is, but I'm always on point with that. So smell is a big deal.
I love that. Is awesome, dude. This looks like it smells. Yeah, it smells. That's bad. So hey, final question, and this is COVID is real. You don't know anybody who has COVID, or have you experienced any of that close to you or anything like that?
I mean, every other day I think I have COVID, right? Like your throat scratches and you're like, oh crap, I think I have COVID. Like, and like my sister got sick like last week and we thought it was COVID. She had all the signs, but it was strep. So it's just, it's uneasy, but I think we all need to like be prepared if it does happen, because I feel at some point all of us will get it at one level or the next. Hopefully it's not so severe, but it's real. It definitely happens. We just have to be careful. And I think going to these professionals like dentists, I think we should feel a little bit more easy about it, because they're trained, they're professionals for a reason. And, if you trust your doctor, definitely go see him if you think it's a priority. And if it's not, stay home, stay safe. You don't need your teeth clean every 6 months. Yeah, you do.
You're awesome.
I'm pretty bad about that, but
hey,
I'm okay. They look white.
Dude, hold on. You're talking to the worst, but we're not going to get into that. First of all, Darina, thank you so much for joining me and just kind of saying how it is. It wasn't too bad, was it?
No, it wasn't.
No, I only heard one row, and I saw the eyes get big and everything. But first of all, really appreciate you sharing your perspective, sharing your experience, and the sentiment behind it. I love kind of things that you pointed out about show me the cleaning equipment, explain to me, don't overdo it. This place has to smell good. And it's so funny. I never thought about that. If it smells good, you immediately feel that. And then most importantly, stay safe. They're professionals. And it's so true. when you look at the dental profession, they're professionals. So, any final words?
Floss and brush your teeth.
Okay, yeah, no floss and brush your teeth. Hey, those of you who are watching, thank you so much for joining us, and thank you for spending the time here with Darina. If you have any questions or would like us to address them, please send them over. If you like the content of this and you like the interview with and the time with Darina, please share it. This is Dental Voice, Season 2, and hopefully we were able to share some really cool experiences with you, and thank you for coming. Thank you, Darina. It was a pleasure. You are one cool person. I got to hang out with you some more. I know. Thank you so much. Have a great week, and we'll talk to you later. Thanks, everyone.